Nigeria celebrates officers, men and women for sacrifices and commitment to the fatherland on National Police Day.
Nigeria reviews policy on countering violent extremism.
And federal government reevaluates 2025 budget to reflect current global economic realities.
On Good Morning Nigeria today, our focus is on expanding access to healthcare in the country.
All right, so did you know that Nigeria has begun a year-long campaign to improve on health care for all, especially pregnant women and newborns? Now, this is to ensure governments and, of course, the health community do more to prevent the deaths of mothers and infants in the country.
Well, it's a goal we can't, quite frankly, afford to fail at, because it is quite difficult to accept that 40 million Nigerian women are confronted with high health risks related to childbirth at 2.4% of the global population. Nigeria sadly contributes close to 10% of pregnancy-related global maternal deaths.
That's because you men would not allow women to rest forever.
I think it's the other way around.
Anyway, the country's maternal mortality rate currently stands at 576 per 100,000 live births. Now, that makes, the country the fourth largest in the world.
Well, these are really disturbing figures, Claire. Now, Nigeria also has the second highest infant mortality rate at birth in the world. More than 260,000 babies die annually. Now, these deaths are linked to malaria, pneumonia, diarrhea, and account for over half of under 5 deaths in the country.
And, that is even worsened by the fact that the country's healthcare infrastructure is, of course, deficient. And there are many poorly equipped primary healthcare centers across the country, especially in the rural areas. Now, there's also the issue of brain drain. I mean, we've been talking all about it, health workers, leaving the country. And of course, with just 35,000 doctors currently, of course, you will recall 35,000. 35,000. Yes, you will recall that 230,000 are required to meet the ratio per patient in Nigeria.
Let me also mention medical tourism, which accounts for the loss of 2 billion US dollars. That is more than 3 trillion naira every year. Recall the country's 2025 budget for health is 2.48 trillion naira. There is also lack of health insurance. Well, maybe a little, which is forcing 75% of the population to pay out of pocket for health care.
Absolutely. Now, concerned persons believe that Nigeria's healthcare system needs digital solutions and, of course, improvement in emergency services. They also suggest they need to look inwards for creative homegrown solutions to the country's healthcare financing challenges. Now, apart from that, they're insisting on homegrown solutions to issues like, external funding. External funding quotes, from countries like the US. We know what Donald Trump is doing at the moment in terms of HIV, malaria, and tuberculosis. But these require careful planning for us to do that. And of course, bold decisions are also needed. So how can Nigeria ensure that all citizens, receive quality affordable healthcare services? That will be our focus today on Good Morning Nigeria. And of course, I'd like to welcome you as always to the program. I am Claire Adilabu Abdul Razak, and Victor is here.
Well, I am Victor Azu. Thanks for joining us, and we are reaching you live on the network service of the NTA I've seen Chukwudi Okoli somewhere around. I'm sure he'll join us a bit later for the newspaper review.
In the building.
But first, let's get the news highlights with beautiful Mina Daniels. Good morning, Mina.
Good morning, Victor and Claire. Here is the morning news. Nigeria is going into deeper collaborations with Sweden in areas of digital economy, health, agriculture, and other critical sectors of development. Vice President Kashim Shettima stated this when he received the Crown Princess of Sweden, Victoria Alice Desiree. Nigeria has commemorated the National Policy Day at an event dedicated to honoring the brave men and women of the Nigerian police force who selflessly serve the nation, protect communities, and uphold the rule of law. President Bola Tinubu, represented by Vice President Kashim Shettima, described the event as recognition of the sacrifices and commitment demonstrated daily by officers across the country.
I reaffirm this administration's steadfast dedication to the welfare and empowerment of the Nigerian Police Force. A secure Nigeria is vital for our collective prosperity.
The Office of the National Security Advisor is reviewing the policy framework for countering violent extremism. This is because social media platforms are being used to spread violent narratives in the country. The Progressive Governors Forum of the All Progressives Congress, APC, has reaffirmed the party's unity and readiness to secure another victory in the forthcoming general elections. Led by the forum's chairman, Governor Hope Uzodinma, the governors made this known during a courtesy visit to former President Muhammadu Buhari in Kaduna.
He's well pleased with us and is happy that we visited him. And even though he expressed surprise for the visit, but I think it is on our part a very good initiative that we should touch base with our father in politics.
Minister of Finance and Coordinating Minister of the Economy, Wale Edun, says the federal government is reviewing the 2025 budget to reflect current global economic realities. This is as he believes the present tariff regime of the United States of America is an opportunity to further grow Nigeria's economy. This was at the unveiling of the Ministry of Finance Incorporated Corporate Governance Scorecard in Abuja. And Nigeria's First Lady, Oluremi Tinubu, has been called upon to lead another health initiative in the country, this time for a campaign to eliminate cervical cancer. This was when a delegation from the National Task Force on Elimination of Cervical Cancer paid an advocacy visit to her office in the villa. She kick-started her new role with an announcement of a 1 billion naira donation from Renewed Hope Initiative to the partnership. The federal government has initiated a technical upgrade for media organizations, investing in cutting-edge technologies and state-of-the-art equipment to enhance service delivery. Minister of Information and National Orientation, Mohammed Idris, announced this during the National Association of Broadcasters NAB Show 2025 in Las Vegas, Nevada. The upgrade aims to replace obsolete infrastructure across federal radio and television stations. The ministry is forging partnerships with broadcast equipment manufacturers to provide local broadcasters with emerging technologies and industry-specific training. This collaboration will strengthen Nigeria's information dissemination framework, ensuring effective communication of the renewed hope agenda policies of the Nigerian people. Idris emphasized the importance of strategic communication in achieving this goal. The Nigerian delegation, led by Idris, includes senior officials from key media organizations. They aim to forge new partnerships, explore content sharing opportunities, and enhance collaboration within the global broadcasting sector. The NAB show, themed "The Technology, the Trend, the Future," provides valuable insights into industry trends, covering topics like artificial intelligence, cloud visualization, and sports production and streaming. And so those are the highlights of the news at this time. Good Morning Nigeria continues with Claire and Victor after the break.
I am Oluremi Tinubu, the global and national Stop TB champion. Many people have asked why I've chosen to champion the fight against a disease like tuberculosis. My reason stems from a deep personal experience. I once had a friend who unfortunately fell ill and concealed the nature of his sickness until it was too late. Eventually, after he passed, we discovered he had tuberculosis. Sadly, due to the stigma and discrimination surrounding the disease, he would not speak up or seek for help. His death was a painful reminder that we could have intervened and saved a life if only we had known earlier. Tuberculosis is an airborne disease that primarily affects the lungs, but can also impact other parts of the body. Being airborne means anyone, regardless of their social economic status, can contract it. In Nigeria, one person dies of TB-related illness every 7 minutes, amounting to 206 deaths every day. Globally, one person succumbs to TB every 25 seconds, which is a staggering 3,456 lives lost daily. These deaths are entirely preventable because TB is curable if detected and treated early. If you or someone you know has been coughing for 2 weeks or more, coughing up blood, experiencing night sweats, or losing weight drastically, it might be TB. Please visit the nearest government hospital or primary health care center for proper diagnosis and treatment. TB treatment is free in all government and some private health facilities. Let us also remember not to stigmatize or discriminate against TB patients or those who have been treated for TB. Individuals who have been cured of TB cannot infect others. I call on all stakeholders, especially the private sector, to join us in the fight to end TB in Nigeria. Together, we can make a difference. Remember, TB anywhere is TB everywhere. End TB by 2030. Yes, we can.
The world needs mums. With a splash of Golden Terra oil, a mom can transform a frown into a smile. Change no thanks into yes please. Resolve family feuds without blowing a whistle. Providing tasty family meals is all that matters. Where there are moms, there is love. Golden Terra oil, for pure love.
In today's fast-paced world, staying ahead demands peak performance from our bodies.
Like never before, our bodies need an optimum supply of essential nutrients, and Supermalt supports our daily nutritional needs.
Supermalt has 20 essential vitamins, minerals, and natural extracts for overall health and wellness. One Supermalt a day gives you energy and vitality, improves your mental performance, and supports your immunity.
Some say learning is fun, but as a mom, I see how demanding it can be for my child. That's why I ensure he starts every day with a cup of Bonvita. Bonvita, prepare them to win every day.
Our major currency unit is the Naira, while the minor unit is the Kobo. They are both in notes and coins. The Naira is more than just a medium of exchange. It bears the images of our heroes. So, stop abusing the Naira. It is a criminal offense to spray the Naira at events. Stop stepping on the Naira. It's not your enemy. Do not squeeze, ruffle, or write on the Naira. Handling the Naira with dirty or oily hands can deface the Naira. Love the Naira as you love yourself. Be a real Nigerian. Do not abuse the Naira.
Hey Nigeria, ready to breathe cleaner air and save money? Let's talk about gas. Drive with CNG, the smart, cost-effective choice. Fill up for less and travel further. Save money, save the planet. Switch to LPG for cooking. It's cleaner, healthier, and better for environment. Say goodbye to smoke and eye problems. Do you know Nigeria is a gas nation ranked 9th globally with over 209 trillion cubic feet of gas reserve? Gas isn't just for cooking and driving. It powers industries too. Cleaner, cheaper, and more efficient. And the best part, conversion centers are popping up everywhere. It's never been easier to switch to gas. Join the cleaner energy revolution. Choose LPG for cooking and CNG for your vehicles. Clean energy for brighter future. This message is brought to you by the Office of the Honorable Minister of State for Petroleum Resources, Gas, supported by the Nigeria Midstream and Downstream Petroleum Regulatory Authority, NMDPRA.
All right, we thank you so very much for staying with us. And up next for us is the newspaper review.
And we're glad to welcome Chukwudi Okudugbaja to review the newspapers for us this morning. Chukwudi, good morning and welcome.
Claire, how are you doing?
I'm good.
Good
thank
morning.
you. Good morning.
And good morning, Victor. How are you
Good
doing as
morning.
well?
I'm all right.
Good to see you.
Same here.
You're clad in blue, even up to the feet.
I love blue. I love blue.
Sometimes.
You're sportish.
I love blue. I love blue. I love blue.
You love blue?
Yes.
I don't see you wear blue.
Just say you love me. Well, let's begin with the Daily Trust. And the lead story here reads, Split in Hajj Commission. Board members accuse chairman of abuse of office. Body's activities guided by rules. That's according to the NACON boss. And the story is on pages 3 and 4. Just above that story, it's a threefold. 6 killed, 59 abducted as bandits attack Katsina communities. It's on page 6. And while lung cancer is silently killing Nigerians, if you care to know, read it up on page 42. In crisis, Chief of Army Staff visits Plateau, sues for peace. That story is on page 8. And of course, the picture story details the Take It Back protests in parts of the country. Take It Back movement, police tear gas, disperse protesters is on page 5. And finally, road construction, motorists spend hours in Zuba traffic gridlock, page 28. Again, truck kills 1, crushes 5 vehicles on FCT Road, page 28. And APC governors visit Buhari in Kaduna, it's on page 15. Let's see the Nation. Quite busy this morning, but the lead story reads, Federal government allays fears over 14% Trump trade tariff. Economic team assessing impact on budget 2025 assumptions to determine response. Okay. Just above the nameplate, of course, the police dispatch story is there, and more troops for deployment in troubled Plateau communities is on page 25. 19.4 billion naira contract fraud. BPP director testifies against Sirika, page 3. And APC governor's visit to Buhari, a show of unity and strength, is on page 2. Just below the nameplate, Akpoti Uduagha slams 5 billion naira defamation suit on Webonyi, is on page 2. Okay, First Lady's RHI backs battle against cervical cancer with 1 billion naira. You can get details on page 2 as well. Abure-led LP threatens sanctions on OT. Obi say they lack power to call NEC meeting. Is my final take on the Nation, Claire.
Thank you, Victor. And I always admire your enthusiasm. You know, I love you like a younger brother, like a son, rather. Anyway,
Mr. Abdul Razak is not going to court.
No.
What he said was platonic.
Yeah.
Claire.
No, but that's why I said I love his enthusiasm.
He's mischievous sometimes.
She's diverting attention.
Anyway, let's look at the front page of the Daily Times. And it says, police fire tear gas to disperse protesters in Abuja and Port Harcourt as federal government restates citizens' freedom of expression. And the other story there is, I think Victor has also taken it. It's about the BPP testifying against ex-aviation minister Sirika. 84-year-old woman charged for scamming son. That's ridiculous. Now, cattle rustled, 3 villagers killed, 2 others injured as Lakurawa terrorists invade Katsina community. And just above the nameplate, of course, we liked, okay, Victor has also read this about Abure, Slamin Obi, and others. All right, I think that's about all from the Daily Times. We're back now to Chukwudi Okoli Ubuaja. Chooks the boy.
Thank you, Claire. What's that bit about Haji Sirika?
19.4 billion naira fraud. BPP director to testify against Sirika. I don't know how that, the same
contract fraud.
You know, when he's in court, you have to guard your lips. Otherwise, I wanted to ask where that spanking new airline of his is today. Anyhow, the federal government allays fears over 14% Trump trade tariff. Nigeria is lucky. He slammed 17% on their best friend, Israel. The one thing about Trump, I'm not his fan, I keep telling whoever cares to listen, is that what he's doing now, he started preaching in his 30s. So it's not as if he just invented it. But
why is he sending warnings to China?
If I were
to retract,
if they don't retract the 54% Islam on them, it would Islam another 50%.
And then they too will retaliate.
If I were a newspaper columnist, you know what I'll write this morning? Way of the boomerang. The Trump trade tariffs may return to haunt its author. You know, that's how I would title my piece.
With the trade war, we've seen this is not the first time we're experiencing trade wars, you know. It
happened in his first term, by the way.
Apart from the first term, trade wars have always been.
It was in the 1930s edition that was actually the real thing. But the world suffered for it. I think we should always do things that take us into the modern world. Trump should not give the impression of street trading, touching on vindictiveness. I'm not one of his fans, so let me not assassinate his character on the air. But he's got to think. Abure-led Labour Party threatens sanctions on OTOB. They say they lack powers to call NEC meeting. You know, some of these Supreme Court rulings, I don't understand it. Well, I don't have the privilege of wearing the wig, so I won't understand them. I'm not one of their learned friends.
The interpretations, I've heard several.
Why shouldn't there be interpretation from the courts so that
you know what they tell you? You know what they tell you? And talkative Chukwudi falls silent immediately that is said. A judge does not rule on what is not presented to him or her. They always dwell on specificity. So the ruling was not about who should be there.
Even the specificity.
It reminds me of one old man in my village. Troublesome women will bring a case to him. Ada,
you have come again.
Ada, can
you retract?
Now, two of you take your trouble to your husband's household. Let me rest.
Okay, Chukwudi.
You win, you win.
Oga Chukwudi.
Yes.
Retract that. Women are not troublesome. I just told.
I said what the elderly man called those women.
Those
women were not necessarily representative of the women folk. Claire, leave this activism now.
No, there's no activism. It's just the reality.
Okay.
It's just the reality. We misinterpret women when they try to stand for their rights.
Yes.
And I just told Victor this morning that the reason why maternity is going high is because men refuse to do what they should do. and refuse to leave women
Claire,
alone. Anyway, that's another matter.
I respect women to the hilt. A lady beat me in final year at Uniben in 1984. Since then, okay.
Anyway, what I think the other story too is and I wanted to talk on this. The police tear gas. Yesterday, what I saw on TV yesterday was very heartwarming. We saw some of the protesters, even with the policemen, going, marching, until a particular stage. But the fact that, in Lagos, there was a calm protest, and the police, was also guiding the protesters. And I thought that was something that...
so where did the tear gas story come from?
It's in Port Harcourt and Abuja.
Port Harcourt.
Yes.
The question is this. Did they show unruly behavior? Because if they were exercising their right to protest peacefully, I wouldn't want to hear about the tear gas, the circumstance of that tear gas.
Well,
we'll look into it to make sure that people are allowed to, exercise there. But on the whole, we must applaud them for being, decent about it. I think so, Claire.
But again, the writer to that story says, federal government restates citizens' freedom of expression. I don't know the content. Yes.
That's what I was, driving at. Very important.
Well, even the police statement that was released just the day before also acknowledged the right to protest peacefully. But while, encouraging them while telling them that the timing was wrong because we were going to have visitors.
They said it was police day.
Police day, and I would have visitors in the country.
Visitors as well.
That it was an attempt to smear the police, before visitors and all of that.
Those who want to give Nigeria a bad name will continue to try to give Nigeria a bad name. The important thing is, let Nigeria not give itself a bad name. Your detractors will always be there, even in your village. They're always there. The important thing is, what sort of image do I project so that at the end of the day, it's my word against his? You understand? I don't let people assail me easily. You put up a reputation that speaks for itself, Claire. Am I pushing out my chest enough?
Well, the Natasha case won't go away. I've now lost count of how many cases there are in court. And this one reads, Akpotu Duanga slams 5 billion naira defamation suit on Ebonyi. That's the senator from Ebonyi State.
Victor, eventually they will all come together and settle this matter. You know how I started off? I said, did Natasha impugn Senate laws? Handle that. After that, the other things she complained about, did they happen? But even then, why was it coming out at that point?
This matter is still in court, remember?
So these are the things we should not depart from. I'm talking about civility of thinking. I don't wear the wig. I can't be their learned friend. Even though Kuotimo wanted to be that to Femi Falana at the Oputa panel. Then Falana told him, you are not my learned friend, my dear.
There's a story there. There's a story in front of the nation. More troops for deployment, I think.
That's just
yes,
Bokos local government area of... I get tired of saying this. Good old Jos. I was there for 4 years. If you want to live a simple life, go to Plateau State and live your life. Nobody cares how you live your life. Everybody's so civil. Everybody's so homely. Actually, James Mannock, he was then the media person for Jonah Jang. He said, Chukudi, it is outsiders that bring trouble to us here. Otherwise, we live in peaceful coexistence. But the words of the chief of army staff should actually guide us in this matter. He says, that's Oluede, he says, even if we deploy 1 million troops here, if you don't learn to be tolerant, believe in peace, nothing is going to work. He became, it was an advisory to them. He stopped being a military man, taking down any obstacle, to talk to hearts. That, at the end of the day, will win the day for the people of Plateau. Let them stay at it.
I think there's a lot of work to be done to win the hearts and minds of the people in Plateau State, not just in Plateau State, in other parts of the country where we have, similar conflicts and all that. it's not just deployment of troops,
yes,
deployment of military, operations and all that. The governments at that level need to understand, need to show serious political will to do the right thing.
Yes,
what is the root cause of the triggers?
The root causes are there. Scarce grazing fields, indigenous settler, whatever, and all that. Africa, I keep on saying, is clannish.
They are socio-economic, and they can be resolved.
They're not socio-economic. Some of it is tribal to some extent. Indigenous settler matter is part of it. Well, I was there. So let them settle it. I said the other time, I'm not arguing for any particular party to the conflict, but the people who develop where you come from are not necessarily people who are natives. They're usually people from outside. The other time I said, one day in Nigeria, I want to hear that somebody from Adamawa becomes governor in Delta State. Nigerians will tell you, hey, what? What did you just say?
Well, that's
because
happened.
that is how we think in Africa. And it doesn't help Africa.
Well,
it doesn't. It will never.
Let's dispatch you as special envoy
I know I'm over talking.
to Plateau State.
Okay.
Thank you very much.
Is it dispatch or disperse? Which one? I did
dispatch.
You wanted to dispatch me, Claire. Don't take him up on the point of grammar. He's not doing badly.
Have a good day.
Well, we'll see you again tomorrow. Good morning, Nigeria continues after this break. Please don't go away.
From the Atlantic across the savannah to the Sahara, we rise, a land of the free, we know they tire. We dream great, our spirit is undying.
Resilient, rooted like palm tree, we sway in colors, with undoubted demand. We make solutions, we ignite passion, yeah. Ethnicity is unique, we have more than just a nation.
We are Nigeria, strengthening unity, we know they carry lives. We are Nigeria, together live the dream of a land with great destiny. We are Nigeria.
I am the real Nigerian. Brought to you by the National Orientation Agency, NOA.
Have you heard the news? The federal government of Nigeria, through its direct benefit transfer program, has started the disbursement of 75,000 naira per household in 3 installments of 25,000, 25,000, 25,000 naira. Each recipient must have a validated national identification number, NIN, to receive the payment on behalf of their household members. To benefit, your household must be in the National Social Register of Poor and Vulnerable Households in Nigeria. The federal government's direct benefit transfer program is helping to reduce the effect of suffering while promoting financial and economic inclusion for the poor and vulnerable population in Nigeria.
Ìjọba fún wa ní 75,000. NIN mi àti káàdì láti lọ gbà. Nígbà tí mo sì gbà, mo fi ṣe nǹkan tó dáa, mo ra oògùn nínú rẹ̀. Mo ra oúnjẹ tí màá jẹ nínú rẹ̀. Mo sì wọkọ̀ mi náà ń bẹ. A sì fi yòókù ṣe ọ̀rọ̀ ajé pé ká tó máa rí dé bá. A dúpẹ́ lọ́wọ́ ìjọba wa òkè.
This message is brought to you by the Federal Ministry of Information and National Orientation, Federal Ministry of Humanitarian Affairs and Poverty Reduction, in collaboration with the National Social Investment Programs Agency, National Social Safety Net's Coordinating Office, and the National Cash Transfer Office.
The Nigeria Coat of Arms is the official seal that represents the authority of the Federal Republic of Nigeria, hung on the wall behind the seat of the principal officer of the government, supported by the portrait of the serving President of the Federal Republic of Nigeria. It has 7 features. The black shield stands for Good Earth of Nigeria. The silver wavy band stands for the confluence of rivers Niger and Benue. The 2 white horses stands for dignity. The yellow flora is a common wildflower throughout Nigeria. The red eagle stands for strength. The wreath is in our national colors of green, white, green. The motto, unity and faith, Peace and progress is written on a beautiful yellow ribbon, and it's a maxim for all Nigerians. Be a real Nigerian.
The counsel of our fathers.
My advice to these young people is please do not take us back to those harrowing days. You probably do not know what it is.
Nigerian youths, let's build our nation together.
Nigeria is perched on the treasure trove of solid minerals. Gold, coal, tantalum, tin, but none is more critical to our future or the world's future like lithium.
Let's talk about illegal mining operations. What is our strategy?
Welcome to Silver Oasis.
Silver Oasis, a TV series dedicated to aging and older persons in Nigeria. Be part of this series and discover the transformative programs crafted to give a new lease of life to our senior citizens, courtesy of the National Senior Citizen Center.
The National Senior Citizen Center is the oasis for the senior citizens.
For thought-provoking discussions on aging, geriatric social care, and issues that matter most to our senior citizens.
Silver Oasis.
Silver Oasis.
Silver Oasis.
Tune in to Silver Oasis on the network service of the NTA every Saturday at 10:05 p.m. Silver Oasis, improving the quality of lives of senior citizens.
Welcome back to Good Morning Nigeria, and it's live on the network service of the NTA. So we're starting our conversation on expanding access to quality healthcare in Nigeria. And to lead us to our conversation is a background report by our correspondent Ibrahim Dan Amidu.
The World Health Organization has over time indicated that improving access to healthcare is crucial for a reduction in maternal and infant mortality rates. Nigeria's healthcare system is confronted with several challenges, but opportunities for improvement exist. The World Bank notes that increased funding for infrastructure, personnel, and services can enhance access through public-private partnerships and innovative financing models, particularly in maternal and child health. The WHO also emphasizes upgrading facilities and equipment, especially in rural areas, to ensure equitable access and improve patient outcomes for mothers and infants. This can be achieved through strengthening healthcare infrastructure, upgrading facilities and equipment in rural areas to ensure equitable access. The World Health Organization believes digital health technologies can also expand access to healthcare services, especially in underserved areas. It cites Sri Lanka's healthcare system as a model for providing free and equitable maternal health services, demonstrating the potential for impactful healthcare reform. Additionally, UNICEF highlights the importance of community health workers and digital health technologies in expanding access to healthcare services. Experts on healthcare policy, financing, and community health will discuss strategies to increase access to quality care and promote community engagement, focusing on reducing maternal and infant mortality rates.
All right. Thank you very much, Ibrahim Dan Hamidu, for that background report. Now, to begin our conversation, which is on expanding access to quality healthcare in Nigeria, let me begin the introduction here by welcoming Dr. Camille Shoretire, Director of Planning, Research and Statistics at the Federal Ministry of Health. A pleasure to welcome you to Good Morning Nigeria.
Good morning, Nigerians.
Let me also welcome Chukwuemeka Ogwanuo, Senior Partnership Manager, Nigeria Health Watch. A pleasure to welcome you.
Thank you very much, Victor.
All right, and stay joining us for this conversation is Professor Abdulsalami Nasidi. He's a Pioneer Director General, Nigeria Center for Disease Control and Prevention, NCDC. Prof, it's always a pleasure to have you with us.
Thank you very much, Nelson. To be with you again.
All
Good
right.
morning.
Thank you. And joining us via Zoom, we can see her from Lagos. We have Professor Bola Olainka, Professor of Medical Micro, Public Health Expert, Independent Global Health Consultant. I hope we got to your designation correct, Professor Olainka.
Yeah, good morning. Good morning, Nigerians. And yes, you got it correctly. Thank you.
Thank you. I'm particularly glad that we're having a female join us for this conversation. It would have been, if we didn't have a female, to talk about issues mostly that affects women. But thank you, gentlemen and lady, for joining us for this conversation. I'm sure that expanding access to quality healthcare in Nigeria, we're not talking about it in vacuum. We're relating it, of course, to the fact that yesterday was celebrated, around the world as International World Health Day. And if we look at the theme, which is healthy beginnings, and and all, yes, I think that is very, very relevant topic. So I'd like to start with Dr. Camille, and I'm just wondering how that relates to our health vision.
Good morning, thank you. The World Health Day that we've been celebrating since the weekend, the theme is Healthy Beginnings, Hopeful Future, and this strongly aligns with the vision of the current administration with our health sector renewal investment initiative that talks about the continuum of care from safe birth to a lifelong well-being. From pregnancy to safe delivery, from delivery of a newborn to growing into a good, healthy child into adulthood, from adolescents growing well appropriately into the adult stage, and also for some of us growing into the elderly stage. This strongly aligns with it, and all that we need to do to ensure that we have a safe pregnancy, safe delivery, and healthy aging are all captured in the health sector renewal investment initiative of the current administration as enshrined in the health sector strategy blueprint, which is guiding the implementation of health sector reforms currently in the country. So the team strongly aligns with what we're currently doing.
Let me stay with you, Dr. Kabil. The federal government has flagged off a year-long campaign to improve healthcare access, of course, particularly for mothers and newborns. Could I ask, what's the big picture strategy behind this? And how is the ministry planning to drive results, at the state and local levels?
Yes.
Because that's how to make impact.
Yes. It's an holistic approach. Health is not something that only Ministry of Health will do. We need multi-sectoral collaboration and cooperation, which we are currently doing. The drive for universal health coverage in the country is based on a strong and efficient, effective primary health care system. So currently the government is revitalizing several thousands of primary health care facilities that have become dilapidated. They built new ones, and with support of state governments, several of them are building more. As we speak now, 3,000 to 4,000 by the end of this year would have been completed in terms of revitalization, re-equipping, and deployment of human resource. This will provide access to our pregnant women to have antenatal care and also skilled birth attendants. And also our challenge with the area of immunization. All these facilities when put in place and resourced with human resource for health, the health skilled professionals to run the system, we make this access for Nigerians, especially those in the underserved rural areas, to have access to child immunization, antenatal care, skilled birth attendants, counseling on appropriate nutritional practices, and all other issues of concern. Of particular note is the rising incidence of non-communicable diseases in our country. So what we are also doing involves all our facilities being able to effectively screen for hypertension, diabetes, and give appropriate counseling on next things to do when you are found to be hypertensive or diabetes to get appropriate care. Government has also put in place a vulnerable group fund and social action fund to help in making sure that communities in their small scale are able to take action, supporting their health facilities, supporting their healthcare delivery at those local levels. And also our expansion of the health insurance coverage for the country. We've had remarkable shifts from what we used to have in the past. In the last 1 year, we have added 2 million lives under insurance cover. Reforms is going on in the health insurance sector. We are cooperating with the ministry, with the 36 states and FCT to ensure that more enrollment are gotten at the subnationals to put more people under insurance cover to reduce the rate of catastrophic expenditure, which are common ailments provided to a typical household in Nigeria.
Dr. Kamel, thank you. Thank you for reeling out all that you are doing. Let me just bring in Professor Natsidi into the conversation. Prof, I'm just thinking that, you know, in relation to the theme for World Health Day, International World Health Day, which is healthy beginning and hopeful, I hope I'm getting it right, future. Of course, in terms of maternal and infant mortality, the indices should tell us whether we are going southwards and northwards. And there are really very disturbing figures that we've gotten. Maternal mortality rate currently stands at 576 per 100,000 live births, making us the 4th largest in the world. And then when we talk about maternal deaths, we're having close to 10% of pregnancy-related global maternal deaths. And of course, like I said, our infant mortality rate at birth in the world is also disturbing, having the second highest. So in terms of the theme for this year, what do you think? Are we making any impact at all?
Okay, thank you for the question once again. Definitely, as we all know, it's unfortunate that a country like ours that is so endowed with so many resources, both natural and human, and with all the facilities, available to us, and will be among the poorest performing nations as regards public health indices in the world. It's very, very embarrassing. This continued, especially, with very poor health indices until about 2020, when we're thinking there will be progress and Nigeria could double up and catch up, and even if possible surpass where we are. So surpass the progressive countries that have attained universal childhood immunization, universal health coverage for their people. What we are seeing is the fact that there must be something missing. What has really occurred that, despite all efforts by both public and private sector and the donors, we are not making much progress. It's just like saying we have development plans, development partners, and yet there's no development. What is really happening? And this is so embarrassing, especially when you are among international experts abroad attending conferences, and they portray our country to be having these poor indices. But it's unfortunate still that we can't expect much if, as we are talking today, only about 49% of healthcare facilities are providing the required services. Only about 41% of the pregnant women do have access, equitable access to high quality healthcare service in the country. And of course, if the funding of the health sector will continue to be what it was. I must say, I'm not a politician, but I would like to at least acknowledge the performance of this government by allocating huge resources to the health sector. Just some few years ago, the year 2001, all African heads of state met in Abuja to discuss the challenges of public health in the continent and the effect of these challenges on the development.
Yes, we've lost contact with Professor Nasidi there. We'll get back to him as soon as we can get that fixed. But let's quickly get Professor Olayinka involved in this conversation. Now, Prof, you've worked across borders, and I ask how you would assess Nigeria's healthcare delivery system, of course, when placed side by side, comparable economies, and where do you think that we should deploy our energy the most?
Okay, thank you. I'll start by saying that I won't talk about an assessment, but I would want us to consider a number of things in our healthcare delivery. I think one of the things that is lacking is the fact that we don't do a root cause analysis of why we are where we are. For example, we've talked about the very poor maternal mortality ratio, even the neonatal mortality ratios, which are really poor in comparison to other countries in Africa. But then we need to ask, why are we here? Why do we have it this poor? I heard about allocation of money to improve healthcare, but healthcare is very broad, it's very wide. Which aspect of healthcare are we dealing with? We first of all need to understand that systemic issues that need to be addressed. Sometimes the answer to a healthcare solution to a healthcare problem might not be building another healthcare center. Let's look at the healthcare centers and facilities we have. What are the issues with them? Sometimes we talk about access. Access is not only a matter of distance. Access might be a matter of financial. A lot of women, particularly, they delay to seek care because of many things. It's not always a distance issue. It might be a financial issue. It may be a fact that the health facility close to them does not have the capacity to deliver the kind of service that they need, either in terms of the human resource, either in terms of the equipment, either in terms of the medications, and so on. So we need to do a root cause analysis of why we're having the mortalities. And of course, this will vary across the different regions within the country. We have delay in seeking care. We have instances in which women may need to wait for the husband before they can seek care. There was something on social media recently about a man who lost the wife and so on. There was a lot around the finances, but there was also that delay in seeking care, which probably was tied to the financial issue. And so it's good to hear about these insurance schemes, but sometimes we also have a lot of bureaucracy around accessing this insurance scheme. One thing is the emergency healthcare is actually not present in Nigeria. When I talk about emergency healthcare, the kind of intervention that needs to be done within 1 hour, and it makes a difference between survival or a good quality of life or a poor quality of life. And those are some of the things that are really missing. So I believe that the government needs to really sit down and say, okay, how do we improve our systems? How do we improve efficiency? How do we improve emergency care, which can be delivered urgently as is needed? And, you know, when if we're saying, okay, yes, we want healthy beginnings and a hopeful future, we really need to look at this. A 1 minute difference, a 1 minute delay in child delivery, either in that child maybe accessing something like oxygen, makes a difference between that child's beginning and the child's future. And we talk about our children being the future of the nation, but they really need to be healthy. And being healthy starts not just from when they're born, even before they are born. And this is where the women come into place. Let's look at our youths, our adolescent girls. How are they being cared for? How is STI care being taken care of? How is pre-pregnancy taken care of? When they get pregnant, how is antenatal care delivery? How is antenatal care process taken care of? And of course, the delivery process itself, and then the care of the newborn, and so on and so forth. So, like I said, I'm not going to compare, but I really want us to go back, sit back, and look at what the gaps are, and put in strategies that that address these gaps, and not just a blanket, we've given money or we're building facilities. That may not solve the problem that we have at hand. Thank you.
Thank you, Professor. Thank you. Thank you. You've really talked from, like someone who's been wearing the shoes. And I like that you touched the different aspects, of access, delay, of course, access not meaning, distance alone, but also delay, the quality of services, the type of services, and of course whether it's affordable or not. And when you look at this, that's why I want to bring in Chukwemeka, who of course has been watching and listening. You've listened to the different items that she talked about, and everything has to do with funding. Everything has to do with funding. And I remember that some time ago in the Abuja Declaration, there was a 15% funding ceiling. What have you observed in terms of funding the healthcare sector in the country? Are we even pushing? Are we raising the bar at all?
Yeah, thank you so much, Madam Claire, and I think this is a very important conversation to have. And I think the speakers have actually highlighted the critical issues, and I'm glad that you've brought the issue of funding. Because currently, right now, we're dealing with the global health space, we're dealing with a situation where the official development assistance from major donors is shrinking, right? And countries like Nigeria are thinking around how they can adopt strategies to ensure sustainability and move towards self-sufficiency. Other countries in Africa are talking about this. I'm also glad to have seen that the Ministry of Health, Federal Ministry of Health and Social Welfare, has taken proactive steps in this regard. When the announcement from the funding cut from the US, for instance, was mentioned, and of course we know that the US government through the USAID are one of the major funders of programs like HIV, malaria, and the Ministry of Health took proactive steps to mobilize funding internally. We saw that the Federal Executive Council approved, I think, about $1 billion to cushion this effect, right? And we've seen that over the years, there's been public financing especially has been very low. There's been a huge dependence on development partners. But we've also seen, especially with the current administration, the current leadership of the Ministry of Health, we've also seen some form of proactive measures even before this funding cut. Like Dr. Camille had mentioned, the Health Sector Renewal Investment Initiative was also in place, and through the SWAP framework to mobilize resources under one framework to ensure that all development assistance coming into the country are channeled through one pool, one plan, one strategy to fund our health sector priorities, right? And in addition to that funding coming from overseas is also mobilizing internal resources, but we need to
But that's still external funding.
That's what I'm saying. So it's funded both with foreign development assistance. So what they're trying to do, or what we've seen they're trying to do, is pool the donors funding health programs, align their priorities, and ensure that the priorities are aligned with the government's health priorities and that of the state government. Then also, the federal government can now see where it's lacking, right? It now becomes more apparent. And what we've also seen is talks to also ensure sustainability of these programs. And I think majorly what is critical is public financing come out. So we've also seen very recently that, of course, there's so much talks around medical tourism, right? For instance, and through the National Health Sector Renewal Investment Initiative, part of the goal is to make Nigeria a medical destination hub, right? And recently I was in a conference by the Healthcare Federation Network, and one of the Healthcare Federation of Nigeria, this is the Association of Private Healthcare Providers, and one of the key issues that was emphasized there is the fact that countries that are doing well in medical tourism are countries that have been able to prioritize public financing to achieve universal health coverage locally, right? You must ensure that your people can access healthcare without financial hardship before you even talk about things like ambitious goals like medical tourism. So it really emphasizes the need for money to come from more resource mobilization from the federal government. And we've also seen that happen in the short term. We also know that this funding that has been mobilized to meet the gap from the funding freeze from countries like the US and the UK is a bit short term. So we want to see more long-term plans to sustain these efforts. The health sector is currently also assessing the impact of such funding freeze in the long term, where these programs have been affected the most. So I think what we're going to see, or what we expect to see happen, is more long-term strategies and long-term plans, to address these funding deficits within the country. And I'm also glad that Dr. Camille, for instance, is at the helm of affairs in addressing this. We at Nigeria Health Watch, we are at the forefront of this conversation.
Now you're talking funding gaps. The Nigeria Health Watch has always talked about the need for more accountability in, the funding. And so what have you identified from your perspective? Where are the gaps, whether in funding or in healthcare delivery, that need to be plugged?
So, funding in our healthcare delivery, it's quite broad, like Professor Olayinka mentioned. There are a couple of gaps where more resources are needed. There's a gap in health insurance. For instance, even we at Nigeria Health Watch, we're also trying to understand how much the funding freeze from USAID will affect health insurance delivery in Nigeria, for instance, because we know that some states health insurance programs are being funded by the US government. So when you pause such funding, right, how much will it affect the healthcare delivery, right? We've also seen the health insurance agency authority led by Dr. Kelechi Ohiri haven't increased capitation fees, for healthcare providers. So we also want to see more, like I said, more public financing to bridge this gap that has been identified. We also know that across healthcare programs, maternal and child health, nutrition programs, we've also seen more efforts by the federal government in the 2025 budget. Nutrition programs was in the budget increased by 33%, right? So we've seen these commitments in this regard, but we really want to see how sustained they would be and how effective the implementation will be, because oftentimes the problem is not just mobilizing more resources. The budget always increases, health budget increases year on year, but oftentimes the fund is not spent, is not completely spent. So you now look at the issue around effective resource utilization, which of course we also hold the government accountable to.
Thank you. Still on the issue of funding, because we've seen the trade war that's going on, and of course the developed economies and their new economic realities at the moment. So I think it also means that those countries that are also relying on external funding will have to look inwards. And I know that there's a basic healthcare provision fund, and that fund, how is it doing, and where are we deploying the fund that is coming into that system?
Thank you very much, and also to appreciate the comments of other panelists. The Basic Healthcare Provision Fund, as we've known, is a creation of the National Health Act 2014, and it simply gets 1% of the Consolidated Revenue Fund to be shared through 4 gateways, through the Health Insurance Agency, and National Primary Healthcare Development Agency, the Nigerian Center for Disease Control, and the Emergency Fund. So it's currently over 8,000 primary healthcare centers, one per ward, are being given direct funding. Direct funding simply means from CBN straight to the account of those primary healthcare to fund their basic needs. Some medicine and consumables to supplement if there is shortage of human resource for there. They can hire people on ad hoc basis to provide, if there's a problem of light, they need to do some wiring. If there's a repair of pumps or their source of water, and also keep the health facility good for access to people in the community. In addition to going to the community to mobilize people, to get them aware that these services are now available closer to you. So that is ongoing.
Are there places right now that you can talk to us that maybe if you say, okay, if you go to maybe Karu or Nyanya or, somewhere in Lagos or this, you will get, one of the healthcare centers that, you have, probably made accessible, that people, can visit and get quality health care. You remember what Professor Lainka said, it's not just the distance, it's also, getting the quality care and all that. So do we have such at the moment that you can boast of?
Yes, we do have. Every local government, an average of 10 wards in every local government, meaning that we have an average of 10 of such facilities. One per ward. Some of them are undergoing upgrade and refurbishment, but we have already done that. Over 8,000 of them are in the pool and currently running. Somebody mentioned the issue of shortage of skilled manpower. It's across the country. Some of those facilities experience this, but as soon as we know, we make intentional actions to make sure that we cushion such a shortage. Also working with the state primary healthcare development agencies of all the 36 states. These are easily made up for. But still, we need more. We need more because like we wanted more women to have access to skilled birth attendants, which currently in our rural areas is at about 30% compared to 70% skilled birth attendants in the urban areas. But let me quickly say something to address some of the issues raised by Professor Olainka. When this government, the current administration came in, we did a diagnostic workshop of the health sector. What is the problem? Why are we not getting results for the investment that we had? And all stakeholders were part of it. This took place around September 2023. And it was from that workshop, the Health Sector Renewal Investment Initiative they're currently operating, we got the backbone on 4 pillars. One, there is need. From that workshop, we rose with a resolution, there is need to improve the governance of the health system. Improve governance. Management at all levels, being accountable, doing what they are supposed to be doing, and of course, ensuring that Nigerians get the needed quality for what they seek. The second one is to improve population health outcome. This has to do with service delivery, making sure that whatever services Nigerians access when they visit any of these facilities is of the appropriate quality. And more importantly is the third one, unlocking the health care value chain. From our experience from the COVID pandemic, we all see that everything we needed, most of the things we needed, had to be imported. So this government has taken it upon itself to set up what we call Presidential Initiative on Unlocking Healthcare Value Chain, the acronym PVAC. What do? Most of the consumables and essential medicine that we use regularly in Nigeria are now to be produced in country through 2 ways. bring the factories, companies that are producing them abroad, to come and establish factory here to produce. Some have started. And in addition, get technical partnership from these foreign companies to support local manufacturers to produce some of these generic products. So, because the National Health Account Analysis of 2022, which result came out in 2023, just about the time the government came into, showed that 70% of household income on health goes on malaria. And most of the malaria products are imported. So now local manufacturing has brought down the price, and then we are making sure that some of these medicine are available at these PHCs, especially the ones of basic healthcare.
But how have all of these impacted affordability? Because, I mean, Prof made reference to someone who died recently, a pregnant woman, simply because the husband was requested to deposit 500,000 naira before they would give them attention, and that lady died with her pregnancy. Yes. Now, with over 70% of healthcare spending still out of pocket, how does the Ministry of Health plan to scale up, insurance, especially in rural communities?
Thank you very much. We mentioned that there are reforms going on in the health insurance sector. In the last 1 year, we were able to add 2 million, and this is with the cooperation of the 36 states of the Federation and FCT. In terms of affordability, we also brought up a report that showed that many women that needed cesarean section from the rural areas end up either losing their babies or losing their lives just because they could not afford cesarean section. So this government has launched what we call maternal and child health, maternal and child mortality reduction innovations and initiative that we call MAMI, meaning that if a woman who is pregnant wants to deliver, and at the PHC they found out that this woman may have difficulty in delivering on her own, that she will need a surgical intervention, which is what we call the cesarean section. Any hospital she goes to, she will have access to cesarean section without necessarily paying. If she cannot afford this, she will not be denied the cesarean
Please,
section.
can you repeat that again? So that, yes.
Any facility, as we speak now, all our tertiary health institutions, teaching hospital, FMCs,
across the country,
have been directed to attend to any woman who has a need for cesarean section and cannot afford. That cesarean section must be done. They will now get the bill calculated for submission, and this will be paid for by the National
But how many are they? How many are they? Because by the time you swoop on these facilities, how many are they able to attend to in a day?
A journey of 1,000 miles starts with a step. We have identified this need. We need to tackle it, and now we have started. Now, process is ongoing with the National Health Insurance Authority to identify private health facilities who have that have the facilities to provide cesarean section to come into this space, because many of these private health facilities are closer to these women than the big facilities. And we are also talking to the state governments, who are the owners of the general hospitals, which are present in virtually all local governments, to buy into this scheme and also use that as an avenue to implement their own health program for their people.
Thank you.
I will just assure you, we have started. Let us watch how it pans out, all right? And then we receive feedback on how to better improve it. Not starting at all is not an option.
I agree with you. Not starting at all is not an option. But again, there's always a problem with when you start and then you find that it is good, and then sustainability of that is another problem. Professor Nasidi, I am throwing this to you. Again, I don't know, how current the statistics you gave us. 49% of existing healthcare and 41% of access. I'm sure that's not the outcome that the Ministry of Health, represented by Dr. Camille, is expecting from the, robust input that he said they are putting into the system. What do you say about, the free cesarean section? Do you think it's sustainable, or is there any other way that can be achieved?
Please, can you come again? What do I think about cesarean section? I didn't hear you very well.
Yes, the free cesarean section, because he said the Federal Ministry of Health has, directed tertiary institutions across the country to take in any woman who has need, for a cesarean section, a C-section, and cannot afford it, to take her and, provide the services for her pro bono at that point. So I'm saying, do you think this is sustainable?
Well, as I said, the key is, what do we do to get Nigeria to improve on its health indices so that we are not among the 4 worst nations with poor health statistics as regards maternal mortality, infant mortality, and so on and so forth. So actions that will improve our situation are those, quality access to quality healthcare at the primary healthcare level. So cesarean section and emergency response, is the issue of, those who have gunshots, injuries, accidents are taken to hospitals, and they say, oh, if you don't bring police report, you are not treated. I'm happy Nigeria has ruled that this is so. This initiative by the Ministry of Health to get all hospitals to respond to any woman that is in need or their need of a cesarean section to act before payment, that is life-saving. But it won't have a major impact on the general, statistics of, maternal mortality and that we are facing. But then secondly, the emphasis, especially if we are going by this, World Health Day theme, is to emphasize on how to make the dream of Professor Olukoya Ransom Kuti, who established the primary healthcare, come true. How can we get more than at least 70, 80% of Nigerians to access, good healthcare system? How can we get them to our children, 80% of our children to be fully immunized? And how can we get, our population to have, other facilities that are outside health sector, like good quality water, good access to information that health education that can increase the awareness of the population on how to, help themselves, and so on and so forth. I think these are the things that, I believe can make major impact. And I'm happy, at the last information provided by the Director of Statistics, Planning and Statistics, shows that the ministry and this government is now going to emphasize in activating, these primary health care, at least 70% of them to be able to provide these essential services that are life-saving, that can reduce our poor statistics in health indices for us to come out of the womb. So yes, it's good to do the cesarean and the tertiary discipline, but how many tertiaries and how many of them can the have access to? What about the private sectors that can provide, these services? Should they also, provide, save the woman and then send their bill? Or is it just the tertiary health institutions that are owned by government? That needs to be clarified.
All right, Professor Nasidi, thank you very much indeed for your intervention. Let me quickly get to Professor Olayinka. And I want your take on the shrinking, foreign aid for health. What's your take on it? And how can Nigeria build a more self-sustaining healthcare system without overdependence on donor funding?
Yeah, it's unfortunate that it's not just Nigeria. I think this is really common across all African countries. we've had this overdependence on foreign support to deliver healthcare to our people. I say it's unfortunate because our countries are blessed. Nigeria is a blessed country. Africa as a continent is a blessed continent with a lot of resources. The resources are not in the right places. They are in wrong hands. They're in the hands of a few. And then we have a lot of people suffering. But I think this is the time for the country to look inwards, for us as a nation to look inwards, for us as a nation to understand what are our priorities. For example, you find out that a lot of what was government-owned in the past in the country has become private-owned. So the government really needs to go back as to how do we harness our resources for the majority of the people and not just leave it in the hands of a few people. Maybe this is the time to go back to those companies and insist on corporate social responsibilities, because we need to find a way to generate funds internally. For example, Nigeria is a country that is subject to a lot of outbreaks. Apart from the routine healthcare, I mean, we're talking of women, we're talking of children, but also looking at the outbreaks, and these things cannot be managed without funds. Now we have a shrinking donor funding from international organizations. And so we need to be able to care for our own people. Yes, we have a large population, but we also have very large resources. There are many states in the north that have a lot of precious minerals. What are we doing with the proceeds from those minerals? There's been a lot of dependence on oil, but beyond oil, we are much more blessed beyond oil in this nation. And we really need to look at everything that could be a source of income, is an income generating avenue or revenue for the country, to be able to protect the health of the people, to be able to serve the people. I know you didn't, I mean, for example, one of the things that came out with this thing is how sustainable are some of these measures? The country will have to have a way of sustaining a lot of these new things that are being done. And this has to be done with national funding and not just international fundings or loans or grants or whatever we've been doing. So this is also something that the government really needs to look into. How do we generate income internally? And I'm not talking about generating income by increasing the tax, people who are already overtaxed and who can hardly survive, but it's really looking at the resources that the country generates. Where does it go to? How does the common man benefit from it? And how do we ensure that it is pooled? You know, sometimes you look at Nigeria and you look at Dubai and you're like, it's the same oil we had for around the same period of time. But the way it's been channeled is different. And I think this is really what government needs to go back to do some homework on.
Okay, let me still remain with you. And I just want you to speak further on the issue of the basic healthcare provision fund, because like you said, you know, access does not just mean you know, the distance. It also means being able to afford quality health care you know, nearest to you. And the basic healthcare provision fund is being disbursed to 4 gateways: National Primary Health Care, the NCDC, of course, the emergency management, emergency, you know, structure, and NHIA. And I'm just wondering, do you think, in terms of the primary health care, if we look at nutrition, if we look at immunization, do you see any impact of that in that area?
Now, that basic healthcare fund, well, it's 1%, wish it could be higher because it's not really addressing the needs. And let's start with the primary healthcare aspect of the fund. So we have some amount going into primary healthcare. Generally, Nigeria has depended on Gavi a lot for vaccines, yes, and then there are countries in Africa that actually have to procure their own vaccines. And I think we'll be getting to that point where we have to begin to procure vaccines and not just receive donated vaccines and find a way of distributing it. So these are some of the areas where we really need to look in we have how does the country get the money to buy the vaccines without the help of donors? In recent times, we had a lot of diphtheria outbreak in the country. And that was one of the things that was suggested was that beyond the EPI, do people need booster doses? Now, if people are going to need booster doses, children are going to need booster doses, then that means the country must be able to procure these extra booster doses that need to be given. So primary healthcare, yes, we have the healthcare centers, but we also have the challenge that a lot of healthcare workers are not well paid. Don't get the healthcare personnel that have the right competence at the healthcare facilities. The primary healthcare facility is supposed to be that facility that can meet the need of a family. It's supposed to be like the family clinic. It can meet the needs of the man, the woman, and the children, and take care of everything they need basically in terms of health. But currently, some states are quite good with the primary healthcare center, and Lagos State is one of those. But if you go to some other states, the primary healthcare center is maybe just being manned by a junior community health extension worker. Now, the training of that person and the ability to make crucial decisions are a bit limited. And so we need to look at a primary healthcare center, not just as a facility with somebody who can, maybe provide some health educations and do some basic things, but a center that can meet the needs of the people. And we need to look at how we can upgrade our primary healthcare facilities to that level. Now, let's come to the aspect that goes to the NCDC. Nigeria is a country that I think has outbreaks every month of the year. We are never out of an outbreak. If it's not Lassa fever, it's meningitis. If it's not meningitis, it's measles. If it's not measles, it's cholera, and it goes on and on. And so many people are dying because of this access, financial access in distance. And then there are some of these diseases that really, when you have this kind of outbreaks, people should not pay to manage an outbreak. The government should manage the outbreak, and it means treatment should be free when it is during an outbreak. But with the money that is currently being given from the Basic Healthcare Provision Fund, can it do this for the number of people who are affected by the outbreaks across all the states that we have in the country? Then looking at the third part, which is around trauma care, it's a very good thing because, accidents, you need an emergency intervention. But I think for me, the limitation is where the accidents happen are very far from where people can have this emergency intervention. Do we have functioning ambulance services that can pick anybody from anywhere and take them to where they can have access to these services, like a national ambulance system? Those are some of the things that should look into. Healthcare insurance, yes, it works maybe for people in urban areas, but what about the people in the rural area? How do they access this? How does this work for them? These are some of the questions that we need to be asking, and also to critically think about how we can address to improve our indices in the country. Thank you.
All right, Professor Olayinka, thank you very much for your contributions so far. We'll pause here to take a break, and when we return, I would like to take on Mr. Ogwanwa on some of the issues that he should be concerned with. Please stay with us. Good Morning Nigeria returns shortly.
The Nigerian national flag represents our country's history, culture, and identity. It was designed in 1959. The colors are Emerald Green 2.0, which represents agriculture, and Immaculate White represents unity and peace. Know how to handle our flag. Illuminate the environment, or don't fly the flag overnight. Do not fly a dirty or tattered flag. Take such flag to the nearest National Orientation Agency office for proper disposal and replacement. The national flag can only be flown at half-mast on the directive of the federal government. The national flag must be flown at the same or higher height when displayed alongside other flags. Don't burn or allow the national flag to fall on the ground. Do not print, decorate, modify, or insert the coat of arms on the flag. Our national heroes are not buried with the flag. They are honored by presenting it to their next of kin during interment. Respect our national flag. Be a real Nigerian.
This message was brought to you by the National Orientation Agency, NOA.
The business environment, to be honest with you, has been extremely hard on most Nigerian women's businesses, and of course harsh for a number of reasons. There is no way you would increase or move subsidy and increase the price of fuel that it doesn't have the counter effect. It has been very challenging for so many women. I know that a lot of them have cried in one way or the other to us to find ways of intervening, but that is not to say that it is all doom and gloom. We will still have a few percentage of women that are thriving in this economy, but we hope that we'll be able to get a larger percentage. One of the things I've seen with even our local purchases now is that people are buying more made in Nigerian options of food, of clothing, and so on and so forth than the imported. So that again is helping some of our industries thrive. Surprisingly, the telecommunications is still doing well, and the reason is very simple. A lot of people are going for online options of skills in terms of training, communications, even remote working. And so you will see that people that provide services around those areas also thrive. But I think at the end of the day, it's about partnerships, collaboration, and influencing power from especially the private sector and even the public sector. But we really need the public sector to drive a number of things, especially policies, because the public sector has the national spread above even whatever we can do in our own small way. What has happened over the years is that even the government, for example, is being pulled from different angles by all these stakeholders. We need to harness ourselves to have strategic focus areas, and we should all be moving in the same direction, not using a competitive approach, but a collaborative approach. Secondly, in collaboration, we need to move with large clusters of decision makers. Instead of, the process of reaching out to individuals is painstakingly long and it takes time. And so we need to engage these stakeholders on a larger platform. I think it's very important to identify where you can get help in your own little way. And one of the things I've realized is that when you operate in silo, it is difficult for you to lift yourself out of the situation. Identify ways you can do what you are doing in a simpler way. And if what you are doing is no more profitable, why not find out what can you do in the meantime that will help you? You need to think outside the box and then connect. What you can do is also identify people and become a cluster to provide a service that ordinarily you cannot do alone.
All right, many thanks for staying with us. This is Good Morning Nigeria on the network service of the NTA if you've just joined us. And we've been discussing expanding access to quality health care in the country. Now, before we went on break, we were talking about, government and the role it needs to play to plug gaps here and there. But back to you, Chukwuemeka. You see, beyond government intervention, with what role can partnerships with the civil society, the media, the private sector play in driving community-based solutions and behavioral change?
Thank you so much. I think that's an interesting angle. Partnerships, the role of partnerships can't be overemphasized, whether it's public-private partnerships or partnerships at the community level. For instance, at the private sector, we know that almost 70% of healthcare delivery happens in private facilities, right? So you can't ignore such stakeholders, critical stakeholders in this regard. You have to leverage the strengths of both sectors. Now, coming to the community level, like you mentioned, one area that we've seen that has been lacking, like you had asked previously, is how we leverage our understanding of cultural norms, right? And how this in fact, impacts the perception of healthcare delivery and also access to healthcare delivery. So, for instance, aligned with the theme of this year's World Health Day around maternal health, we've seen situations like where pregnant women, refuse to receive care because a particular song isn't sung to them when they want to give birth in the hospital, so they prefer to go to the traditional birth attendants because they understand how they should be approached and how it should be made fun for them. We've heard that, and we've seen that these things come out when you go closer to the communities to understand how healthcare is delivered at that level. I'll give you an example. In Nigeria Health Watch, one of the key things we are very keen on is really generating evidence on how healthcare is delivered at the community level. Thereby, you now use that evidence to engage with policymakers, to really present that evidence, amplify community voices on their pain points and critical issues that are driving low access to healthcare. Thereby ensuring that the policymakers and the executive of the state can also pay closer attention to these and address these issues. You also look at when you understand these cultural norms, you're also able to improve awareness, right, in this regard, engaging them in the language in which they understand, right? In terms of also public partnerships as well, partnerships goes a long way in improving health insurance, for instance, right? So Professor Nasidi mentioned how the MAMI initiative, how private healthcare providers can also be part of that, those that provide those care and also get remuneration from the government in that regard. So if you can't ignore such critical stakeholders in this regard. So then you also look at public-private partnerships in terms of improving efficiency in healthcare delivery. Private providers have the strengths of bringing state-of-the-art facilities, right, in delivering healthcare. So you have to also understand how that can improve the efficiency of healthcare delivery through things like mobile telemedicine, mobile health, digital health services, digital medical record keeping, and how digitalizing our health facilities record, right, can also improve documentation and the use of evidence, right, to inform healthcare delivery. So it's really important to understand what strengths exist within the private sector, both at the national level, at the community level. A lot of organizations, both CSOs, private sector organizations, operate at the community level. And you want to leverage as much of those resources and ongoing programs to ensure that they all build on one another. But I think I'll wrap up by saying that it's also important that while we improve these public partnerships in this regard, it's also we like that the last year there was a landmark policy initiative to give local governments autonomy, right? I think at this point we should be thinking around how that autonomy can improve healthcare delivery and accountability at the local government level. We've seen that Algon has started to take shape, right? Yeah, so we need to also see how local governments, when resources are channeled through the local government, right, how they can now be, the influence and the power can be decentralized, and we are held more accountable at that level and not just at the federal level.
I think I was at a meeting where the minister had conversation with some members of Algon, and they pledged, of course, to partner in that aspect. But you talked about partnership for efficiency. What about partnership, to mitigate brain drain? Maybe now at the bilateral level, because sometimes the Minister for, Honorable Minister State for Health, was in the UK summit, and I know that he lamented, the alarming exodus of Nigerian healthcare professionals. I'd just like to read out some of the statistics. He said between 2020 and 2022, Professor Nasidi, this question is for you. The number of Nigerian doctors leaving the country increased by 145%. He said there was a 70% rise in migrating nurses and midwives, staggering 900% surge in medical laboratory scientists leaving the country, 68% of doctors and 52% of nurses, midwives relocated to the UK. And I'm just wondering, how can we, UK being one of our strategic partners, how can we now begin to relate with the UK in terms of partnership so that it can be mutually beneficial, so that we don't lose all our professionals going to UK. We also have something to retain them.
Well, thank you. It's not a question of wanting to retain them without having the wherewithal to retain them. To make the brain drain extinct, we have to start thinking of how do we provide the facilities that they go to meet there, that they will be most happy to use and live their life as modern doctors. And also, we have to think, how can we match the remuneration that they can get there while they are working as compared to what will be given to them here. And also, we have to be able to match, the type of social services and amenities that the British government will offer them as soon as they arrive. While they are here, they are here looking for a job. That even so, we say we don't have enough doctors. Our doctor population ratio is so low. Yet we have many young doctors graduating, and they will be looking for hospitals where to do internship. These are things that you just can't understand. Well, that is just one way that the brain drain, is so unfortunately embarrassing, so high and embarrassing that it has become an emergency. I was listening to the head of the MDCN and the chairperson of the MDCN, Dr. Fatima Kiari, just 3 or 4 days ago on the same NTA and the AIT. She enumerated the challenges the country is facing as regards our ability to replace those that are even going, to increase training, to empower the training institutions, our medical schools, to be able to produce more doctors, more nurses, more healthcare workers. Like Lagos, Lagos, I think, has now about 4 medical teaching training centers, and some of the states don't have, and I believe that looking inward is how do you stop the drain, and then how do you do something, what do you do to replace those that have gone? And then now the other pathway is the brain gain, that when they go, our partnership with the UK can be that we have exchange program, whereby we allow the doctors to go maybe for 3, 4, 5 years. By the time they come back and to Nigeria to practice again, the country will gain because they must have acquired a lot of technical knowledge on how to use the modern equipment they see there, and the new science that they are exposed to, and technology. So it's one way brain drain, but another way is brain gain. How do we balance it out? How do we do the partnership? So the partnership must be progressive, must be beneficial to both parties. Except the government of Nigeria will now double up on how to address the issue of remuneration of the doctors, how to make their life better here, and how not to keep a trained medical doctor to be jobless. How can you say a country where you have such poor so far infant mortality, maternal mortality, need for healthcare service, and then you have medical personnel not engaged? That shouldn't be heard of. Of course, we don't think that the brain drain is only from Nigeria or from developing countries. Even from Britain, there are recorded brain drains from many British doctors, many British healthcare workers. I worked in London, and I know what is happening. They are even also draining out to Canada, to US, to other countries that they have better pay. So it's the issue of actually addressing things that will make the healthcare workers happy, to be most efficient in their areas of work. Any Nigerian doctor that has a good job, has good remuneration, and has a good exposure to equipment and technology and science and technology will not leave his home. But those who finish and after the housemanship, they have no job, they are ready to go. Nobody can stop them. Lastly, it is so important to address the issue of the fact that issue of medical training and having adequate number of healthcare workers has now become virtually a health security issue, just like availability of the tools you need to use to fight these diseases, availability of vaccine, drugs, availability of personnel. So well, I think it should be addressed right from the budget level. And all these issues of salary differentials and so on and so forth that leads to industrial action in our healthcare system also should be addressed. And the best way to address it is to, get the National Assembly, get the executive to put priority on not just training healthcare workers, but maintaining them, keeping them, and empowering them to do what they have to do.
Professor Nasidi, thank you very much. Very important points that you have raised. But just as we begin to round off this conversation, let me get to Professor Olayinka. And there's a growing call for digital health integration. Now, in your experience, how do you think we can get low-hanging tech-based solutions to bridge the gap in access to healthcare, quality of healthcare in Nigeria?
Okay, so I think one of the good things that has happened over the years in the country is every family has at least one phone. Beyond one phone, they have at least one smartphone. And we have a lot of apps. We have a lot of youths in the country who can develop apps within 30 minutes, 2 hours, if you tell them or give them an idea of what you need. So this might be a low-hanging fruit for the government to harness. One, it empowers our youths because they are doing something productive, something they can work on. They get money to keep their body, soul together if they're engaged in the development of these apps, in the management of these services. So during COVID, for example, there was an app that was deployed, just to use to raise awareness for healthcare workers on how to manage COVID. We know a lot of things happened with COVID using a lot of the tech tools, either for awareness, either for monitoring, and so on and so forth. And I think this is something that we should leverage on. We should leverage on the gains of things that we have used in the past and things that we have learned. Also, during the outbreaks, there was a tool at a time that NCDC was using, which was called SOMAS, which was also a tool by which right from the community level, there could be information sent right to the national level about what is happening. And I think during COVID also, the Federal Ministry of Health did one for the healthcare facilities. One thing is we should not abandon good things. Rather, we should maintain them, we should sustain them, and we should improve on them. So different AI tools have been used in the past across the country for different things. There were states that even had their own tech tools that they were using either for monitoring or for follow-up or for reporting. We should find a way to harness all of this and have a system that works. And I'm still going to bring us back even to World Health Day thing, because I don't want us to forget it. Maybe, yes, I'm a bit passionate about, I do not believe that any woman should die because of pregnancy or because of childbirth. Pregnancy is not a disease. It's a physiologic process. And so people should be able to go through it. So if we have such tools working, especially when we're talking about connectivity, for example, we were told about money. If we have
Professor Olayinka, I wish I could allow you the time that you want. Unfortunately, we just have a few minutes and we need to allow the other guests to also make one or two contributions before we call it a wrap. And I'd just like to come back to Dr. Camille. Let's even look at, because we've been talking about, matters that probably the ordinary Nigerian would not relate with. Somewhere in different parts of the northern country, we hear of malnutrition, a lot of children dying from malnutrition, and I'm wondering what specific program is being, tailored to improve or upscale statistics in terms of nutrition. We're also looking at immunization. It's also another issue that will impact on the indices of our health indices. What is being done in this area to scale up the numbers?
Thank you. And as part of the Health Sector Renewal Investment Initiative, there is a deliberate provision by the ministry in conjunction with the 36 states and the FCT that we need to intensify efforts at immunization. Immunization, let me appreciate all our traditional and religious leaders that have actually brought innovative ways of improving uptake of immunization across the country, especially in northern Nigeria, as led by His Eminence, the Sultan of Sokoto, and other traditional rulers that have been doing that. And we still charge them to continue to do it, to sustain it, because we still have a pocket of communities where children have never been immunized. We refer to as zero-dose children. We want to ask all Nigerians, tell your neighbors, tell your friends about the goodness of immunization so that we can catch all these babies, children, and make sure that they are protected from vaccine-preventable diseases like we see. On nutrition, we cannot divulge level of nutrition of our children, of households, from what is happening in the economy. And we also, with respect to security, a lot of malnutrition happens in our internally displaced camps and communities because people are unable to have produce from their farm. They do not have access to adequate nutrition. But on the part of the federal government, we not only have a policy that has captured what we need to do to improve nutrition at all levels. We are also working with the state governments to ensure that where there are high cases of malnutrition and stunting, what we call ready-to-use therapeutic food, RETF, are provided with support of some of our partners, and the federal government has earmarked monies enough to provide what was quantified to be used for the year. In addition to several billions of naira going to this, because when you add all efforts from every partner that is working in that space, it amounts to something. But more importantly, is that these RETF, we used to import them largely. But now, local production have started in country for people to know what to do. In addition to providing information, education on appropriate feeding practices.
All right, Dr. Camille, thank you very much. We've run out of time completely, but I just have 1 minute for you, Chukwuemeka. How do we get citizens to not only demand better healthcare provision, but also trust the system enough to use it, especially in underserved areas? In a minute, please.
Yeah, thank you very much. I think we need to raise more awareness around what is working. We know that, yes, there are so many challenges here. As bad news also spreads fast. We know that the healthcare system is not perfect, but we also we have a responsibility to spotlight where things are working. The government also has a responsibility to increase more awareness around the healthcare, the efforts to provide healthcare, the health policies that are being made in place. There's a drive now to increase enrollment in health insurance so that we can prevent the kind of issue we saw on social media where a pregnant woman died for lacking, for not inability to pay 500,000. That shows a gap somewhere in health insurance, either as a vulnerable, whether they fall into the vulnerable group or people that are meant to pay for health insurance but are not paying for it. So in health insurance, for instance, the government needs to be a bit more vocal and raise awareness on how people can be insured, because right now it's under responsibility. everyone has a responsibility really to protect themselves.
All right. Chukwemeka Ogwanoa, Senior Partnership Manager, Nigeria Health Watch. We thank you very much for your time and your thoughts on Good Morning Nigeria.
Thank you very much.
And let me also thank from Kaduna, Professor Abdul Salami Nasidi, who is Pioneer Director General of the Nigeria Center for Disease Control and Prevention, NCDC. We thank you for your time, Prof. And also thanking Professor Bola Olayinka, Professor of Medical Public Health Expert and Independent Global Health Consultant. Thank you for joining us and for the perspectives that you brought to the program. And finally, but by no means the least, let me thank Dr. Camille Shoretire, Director, Health Planning, Research and Statistics, Federal Ministry of Health and Social Welfare. Thank you very much for coming on the program.
Thank you very much.
And that's Good Morning Nigeria for today. We thank you very much for your time. We hope you join us again tomorrow. I am Victor Azu.
And I'm Claire Adelabu Abdulrazak. Bye-bye.